Thank you all for joining us today as we announce the largest coordinated healthcare fraud takedown in the history of the Department of Justice. We are announcing today charges against 324 defendants for their alleged participation in healthcare fraud schemes involving approximately $14.6 billion in false claims submitted to Medicare, Medicaid, and other healthcare programs. This enforcement action involves the seizure of cash, as well as luxury vehicles and properties, returning real money to American taxpayers and to our government healthcare programs. We are seeing a disturbing trend of transnational criminal organizations engaging in increasingly sophisticated and complex criminal schemes that defraud the American healthcare system. As part of this takedown, we've identified and charged defendants operating from Russia, Eastern Europe, Pakistan, and other foreign countries. These individuals have infiltrated our healthcare system to steal American taxpayer dollars. As just one example, we dismantled a scheme involving a sophisticated operation run from Russia and Eastern Europe that strategically bought dozens of medical supply companies in the United States and submitted more than $10 billion in fraudulent healthcare claims to Medicare. To make matters worse, these perpetrators used the stolen identities of more than 1 million Americans, spanning all 50 states, to perpetrate this scheme and submit these false claims. But I'm pleased to report that federal agents intercepted and arrested key members of that organization at U.S. airports and the U.S.-Mexico border, cutting off their intended escape routes. This takedown resulted in criminal charges against 74 defendants, including medical professionals who fueled America's deadly opioid crisis for personal profit. These are not isolated instances of poor judgment. These are calculated schemes designed to exploit Americans struggling with addiction while enriching the very people who were duty-bound to help them heal. We charged pill mill operators who prescribed unnecessary opioids. We dismantled networks of corrupt pharmacies that existed solely to distribute drugs to addicts and dealers.
Buckle up, because this is going to be fun, in a laugh so you don't cry sort of way. Let's start with the facts. The Department of Justice pulled off what they called the largest healthcare fraud takedown in history. We're talking 324 defendants, including 96 actual medical professionals, because apparently some doctors skipped the do no harm bit and went straight to do harm to taxpayers' wallets. These geniuses allegedly submitted $14.6 billion in fake claims. That's enough money to actually fund healthcare. One of the schemes included 5 doctors, charged with slapping unnecessary skin grafts on dying hospice patients. That's right, skin grafts on people who are literally on their way out. It's like putting a brand new paint job on a car entering a demolition derby. It's pointless, cruel, and somehow billed to Medicare for over $1 billion. And then there are the opioid scams. Unnecessary prescriptions fueling the epidemic while siphoning funds meant for grannies and the disabled. Now, why does this keep happening? Yes, government-run programs like Medicare and Medicaid. These are noble ideas, healthcare for the elderly, poor, and disabled, but they've turned into a fraudster's playground. Why? Because the system's a bureaucratic maze designed by someone who clearly hates efficiency. Complex billing codes that make quantum physics look simple. Loopholes big enough to drive a luxury yacht through, which, by the way, they seized in these busts. And oversight that's about as effective as a government-run grocery store. Think about it. In a private market, if someone rips you off, you sue or switch providers. But with government healthcare, it's a monopoly on misery. Providers game the system with upcoding, billing for a Ferrari when they gave you a bicycle, or phantom services that never happened. And the scale? Experts estimate hundreds of billions lost annually to fraud worldwide, but in the US, it's turbocharged by our hybrid mess of puppet programs riddled with waste. This isn't new, it's chronic, like that rash you ignore until it bankrupts you. Democrats have taken a leading role in creating the mess. Democrats expanded coverage with the ACA, More government, more money, more targets for scammers. The real failure? Government healthcare's incentives are upside down. No skin in the game means fraud flourishes. We need real reform. Simplify rules, punish criminals harder, and stop treating healthcare like a piñata full of cash. So next time you pay your taxes, remember, a chunk's going to some fraudster's yacht fund.